Hello, it's Judith here. How do you know if you are suffering from anxiety, the sort of anxiety that requires treatment, or maybe you're just a bit of a worrier? How can you tell the difference? And I think there are a number of ways, and it is important to look out for some signs and some symptoms. I'm frequently saying, and have done quite recently, how important it is to seek help as early as possible. Not because it's significantly more difficult to work with you and to help you to deal with your anxiety if you leave it to the last minute. It's just that why go a few more weeks, months, even years, really struggling when if you knew what time to seek help, you could have got it a lot earlier and not had to go through that pain. So that's what this video is about, how to make that decision. If you're suffering from what is frequently known as general anxiety disorder or some form of clinical anxiety, then you will be worrying excessively, possibly 24/7. And alongside that, you will be overthinking things, struggling to make decisions, struggling to focus on anything because so much of your inner attention is being taken up with being anxious. It's hard work being anxious, and it's even more hard work trying to do things when you're anxious. Many people are very restless. Now that can just be to do with the energy in your body that comes from being anxious. It can also, as well as, be to do with the fact that if you were to stop and rest, you might have to think about what's going on with you, and that's something you are avoiding. So as I say, it could be either or both. Because it's so exhausting, you'll be feeling tired. And because it's so exhausting, but your mind is going 19 to the dozen and just doesn't stop, you're probably struggling to sleep, either to get to sleep or to get back to sleep if you wake, or sometimes both. So as well as being exhausted from the anxiety and tired, you're not getting enough sleep because of the anxiety. So you're even more tired, hence the difficulty concentrating and focusing on anything other than the anxiety. There are, however, some physical symptoms, shortness of breath, heart palpitations, and most people who are having panic attacks or anxiety attacks know they're having them and maybe are thinking about seeking help because they're unpleasant. But even if you're not on the full scale of having a panic attack, you are having some of the symptoms of a panic attack. Your body is getting itself ready to take action because it perceives from all the stuff that's going on in your head that there is some threat around that you're going to need to deal with. So you're breathing more quickly, your heart's beating faster, all designed to get oxygen to muscles as soon as possible. So you may not be having a full panic attack, but you may be having those symptoms. You may be having some of the other symptoms that come with a panic attack, which is issues with your digestive system. Could be nausea, could be stomach pain, because one of the things that happens when your body believes it's under threat and is trying to keep you safe is to shut down non-essential functions. And those include your digestive system. So, stomach pain, stomach problems, digestive problems can be a sign of anxiety and a sign that the anxiety is serious enough for you to take action. You can also have muscle tension or pain or aches in your muscles. Again, your body is so tense because of the anxiety that either you feel that tension in your muscles or it leads to pain because your muscles are not meant to be that tense all the time. I can remember a time when I was suffering from anxiety and going for a massage and you know, actually getting the knots out of my back, particularly the back of my shoulders, was really, really painful. And I didn't understand how that was happening. I just thought I wasn't resting enough or something. I don't know what I thought, but I can't remember. But in fact, it was one of the signs of anxiety. Now, I think it's always wise, and I'm pleased when clients do this, and I recommend it if they don't. If you are having physical symptoms, digestive problems, muscle problems, shortness of breath and palpitations, it is always worth consulting your doctor just to make sure it is not physical. But if these symptoms come with that constant worrying, that constant overthinking, it is much more likely that what you're experiencing is a symptom of anxiety rather than a symptom of any physical problems. So, if any of this sounds familiar to you, or if you're aware that somebody you know, maybe somebody in your family or a close friend, talks about these symptoms, then it's time for you or them to take some action. Listen to my last couple of videos about once you've decided to take action, how to go about it. Think about what therapy you want, do some investigation, think about what therapist might be right for you. Again, do some research. Easy enough to do now. Can be a struggle when you're in this state of anxiety. And of course, it's always best if you can get a referral. But be careful about who you choose in terms of the person and what therapy you choose. Make sure as best you can that it's right for you. And know that if it isn't, it's always okay to say so. Anyway, I'm wandering back to something else. Excuse me. So, if you didn't manage to catch all those symptoms, listen back to the video. If you're ticking a fair few of those boxes, then I would suggest it's time to talk to somebody. So please do so. I would be delighted if it was me you were going to talk to, but I am most concerned that you talk to somebody and you find the right somebody for you. But please take action. As I said right at the very beginning, why go through months, maybe years of pain when you could get it sorted now and get rid of all those things that would have happened if you didn't? Okay then, that's me for this week. As always, take care of yourself and I will see you next week. Bye for now.